Hi everyone, my name is Josh Berletich. Today I'll be showing you a video of how to treat a patient that has low back pain. So today with me I have Ariel. Ariel, how are we doing today?
Fine, how are you?
Not too bad considering it's cold and rainy outside at the end of April. So, I see we're having some low back pain. How about you tell me a little bit about what's going on, what you're feeling pain-wise, any other signs and symptoms?
Well, my lower back pain is about a 6 out of a 10.
Okay.
And my right leg radiates pain. It's usually about a 3 out of a 10.
Okay.
It hurts when I sit too long. And then also if I try to bend over and pick something up, it hurts as well. The initial problem stemmed from reaching into my trunk and pulling out something heavy.
Okay.
So that's where it initially started.
All right. So today's treatment approach, we're going to work on a few things. We're going to do what we call McKenzie extension exercises. So we'll kind of go through a progression of those. We'll work on some lumbar stabilization. So that will help strengthen the muscles around the lumbar spine. We'll work on some postural education because you mentioned you have some issues with prolonged sitting and bending over, and you heard it reaching into your trunk, so we'll teach you some proper techniques there. And then lastly, we'll finish up with some modalities with the hot pack and traction, lumbar traction. So with that being said, with the modalities, just need to check a few things before we'll do those later on in the treatment. Couple things like for hot pack, do you have any decreased sensation of hot or cold, any active cancer, any are you receiving any like radiation therapy?
No.
Feeling feverish?
No.
Nope. Any acute inflammation that you know of? All right. For lumbar traction, do we have any like spinal infection that you're aware of, or central cord spinal impingement?
No.
Rheumatoid arthritis?
No.
Osteoporosis? No. All right. You already said no to cancer, so we should be okay there. We should be good to go. So the first thing I'm going to have you do, like I mentioned, we're going to do the McKenzie extension exercises. And kind of the theory behind these exercises is to help reduce the radicular pain and symptoms that you have in your back and in your lower leg. So I'll go ahead and I'll have you lay here on your stomach on the floor here. And I've got a pillow for your head. Would you like a pillow under your hips?
I think I'm okay right now.
Okay, I have a pillow if you need one. So the first thing we're going to have you do is what you're doing right now, just prone lying. So we'll do that, just nice and relaxed. Make sure we're breathing, all right? So we're just relaxing. So with that being said, I would have my patient do this for 3 minutes. I would check on their symptoms, see how they're doing, if pain subsides. If they're not getting any radicular pain in the right leg, maybe progress to a modified prone prep. How are we feeling with this here?
Fine.
Fine. So with that being said, the patient said they're doing fine, so I'm going to transition you into a modified prone prep. So what this is we're kind of doing this, but we got our hand here, and we're making another fist. And we're just going to let our head rest right on our fists. Again, just breathing, relaxing. Just imagine you're at a bed and breakfast in Amish country without all this coronavirus going on. Just nice and peaceful. So again, do this about 3 minutes or so. Check on my patient. Again, see how symptoms are doing. Because, like I said, what we're trying to achieve is reduce the radicular pain and everything of that nature. So if that modified prone prop is going well, then we can transition to a prone prop. So the prone prop would be taking your head off your hands and just raising up a little bit, and we're on our elbows. So we're here, we're just relaxing. Again, breathing, relaxing, just letting kind of your stomach sink to the floor and everything of that nature. As I've repeatedly said, we'll let this go for about 3 minutes. Check on my patient, make sure how we're doing. So how are we doing with this?
Fine.
Hips feeling okay and everything? Need a pillow or anything like that? Alrighty, awesome. So again, we'll go 3 minutes with this, and then if we're able to transition, we'll go to a prone press up. And so with the prone press up, if our patient's able to tolerate, we'd go from here into what they call a yoga cobra. So we're up and we're just relaxing. So you'll probably have some slight bend in the elbows, but you'll relax and you really take that into extension / hyperextension. This one's a little more difficult to achieve because you really got to focus on relaxing the muscles of the back. A lot of times we want to tighten these muscles in the back because our body's not used to this kind of extension. So it's just nice and easy and relaxed. And this will be the last progression we go through. Again, this is a series of progressions. You wouldn't do these all in one setting, but you could do 1 to 2 in a setting depending on how your patient feels. So again, we'll do this for about 3 minutes and then we'll go ahead and relax. So from this point, what I'm going to have you do is I'm going to have you roll over onto your back. We're going to work on some dynamic lumbar stabilization exercises. And it is kind of like what they say. It's stabilizing the lumbar muscles. We're strengthening all those muscles around there. That way we can support the spine and things of that nature. And like I've mentioned, a healthy spine holds back the hands of time. So with this one, what I'm going to have you do is what we call an anterior pelvic tilt. So what you're trying to do is take your pelvis and tilt it up towards your belly button. At the same time, we're tightening our abs here. So for a tactile cue, I'll slide my hand underneath if that doesn't bother you. And you'll push your back into my hand. And we would repeat this for 3 reps times 10. How are we doing with that? Any increased pain with it? Awesome. 2 more for me. Great. Next, we'll transition to working opposite arms. So it is like what I said it is. We're just here and opposite arm. Just like that. Again, focusing on tightening our stomach, trying to push our back into the floor. So bracing our abs. I'm going to slip my hand under here. Give that tactile cue of really pushing our back into the floor. We do this for 3 reps times 10. All right. Next thing I'll have you do is what we call leg raises. It's alternate leg raises, so it's similar like what you did with your arms, but we're doing with the legs. All right? So, for example, what I'm going to have you do here is we're going to come up, have it at 90, back down. We'll come up to this one, again at 90, and back down. Focus on bracing the abdomens, forcing your back into the floor. All right? How are we feeling with that?
Okay.
Any increase or decrease in pain with it?
No.
No? Make sure we're breathing. So again, 3 reps, 10 sets. Here we complete. After that, I'll help you up. And we'll stand up. How are we feeling?
Okay.
Okay, a little dizzy?
Yeah.
You need to sit down?
No,
Need a drink of water or anything
No.
like that?
I'm okay.
Okay, just saw a little twinge there. Are we okay with the back?
I'm fine.
You sure?
Yeah.
Okay, so the next thing what we're going to do is we're going to try to attempt to do some bridges on our stability ball. So, we'll sit on the ball, we'll roll back, to where our shoulder blades are resting on the ball. Our hips are up. We're bracing our abs, and we're doing a bridge. Hold that for about 5 seconds, then come back, and come back out. Brace the abs, make sure our hips are up, and hold for 5 seconds. Go ahead and have you give it a shot. Feel comfortable?
Mm-hmm.
Okay. So we'll roll out. Make sure our hips come off the ball, our shoulder blades are on it. Bring those hips up. Bracing the abs. Hold for 5 seconds. Breathing. And we'll come back. So we're doing some stability ball bridges. Again, working on our core, strengthening our lumbar spine. We do these 3 sets for 10. Alrighty. Awesome. Take your time getting up. So the last thing I'll have you do is I'll go ahead and have you get on my traction table here, so you'll lay on your back. Feeling comfortable?
Yep.
Alrighty. And I'm gonna have this underneath your legs. Okay. So we've already went over the contraindications earlier in the video for traction and for the hot pack. So I would combine the hot pack with the traction. I would go 7 layers, and my 8th layer would be the belts I would have around my patient's waist for traction. For the traction, I have them supined. My goal is to have the legs at around 70 degrees, which this is pretty darn close. I would do intermittent and with my duty cycle of 1 to 3. The timing, since the best benefit for a hot pack is around 15 minutes, we're going to run 15 minutes. I'll give my patient the call light, and every 5 minutes I'll come back, check on how my patient's doing with the traction, and I'll check the skin, like I said, every 5 minutes, check for blanching, see how the skin's responding. So we would do that for 15 minutes. That's all up. Go ahead and get my patient unhooked, and I'll help you up. How do we feel with the traction in the hot pack?
Good.
All right. Did you feel the benefits of the hot pack and the traction?
Mm-hmm.
You know, with that hot pack, again, now I'm not sure if I mentioned it earlier, but it would have been to reduce the inflammation in the back, decrease pain, and the traction was to help kind of push that protrusion back into where it belongs. The last thing I'll have us do is some postural exercises, and these are things that I want you to take home, so kind of like a home exercise program. So the first thing would be proper sitting. So I'll go ahead and have you sit down like you usually do in your office. All right, so we're sitting there. Some pointers I want to make is, make sure we're up nice and straight, so we're not slouched over. Our shoulders are kind of rolled forward, so we want to roll those back a little bit as well. So with this, since you do suffer from prolonged sitting, that increases the pain. What I would recommend is getting up at least once an hour and stretching. If you have a Fitbit, I know it goes off about 10 till the hour to get up and get your steps. But whatever works for you, we just want to make sure we get up and we do some stretching to stretch out that back. That way we're not, again, continually sitting and aggravating and exacerbating the pain in your back and your leg. So with that being said, I also want to see how you stand up from a chair. So go ahead and stand up for me. That's good. Proper technique. We're pushing from the chair. We're using our legs. Our feet are under us. So no issue with that. As far as standing posture, you look pretty good. Again, we want to have a nice curve, lordotic curve in the back here. So we're up nice and tall, shoulders a little bit back. That way we're working on that. The last thing I'll have you do is again, something that will take practice, because you said you had issues with lifting a heavy object out of your car. Just kind of demonstrating the proper lifting technique. So again, I'll give you these things to kind of take home practice. You know, I don't want you doing it if it aggravates the pain anymore. But so we would use my box here for an example. And if it was this low, we make sure we want to bend at the knees and at the hip. So we're here, and we've got the item, and it's close to us when we come up. All right? So I'll go ahead and have you demonstrate that for me one time. Yep, so we're bending at the knees. Keep that weight close to us. All right? Good job. Takes a little bit of practice to, like I said, we want to make sure we bend at the knees, almost like we're going to sit down. Your butt was a little bit out here, all right? But again, it's something we can work on. So one more time for me, just like we're bending at the knees, like you're going to sit down in a chair. Butt's not out here, we're here, and we're up with it, all right? One more time for me. Get close to the object. There you go. Down, like we're sitting in a chair. There you go. And up. All right. Little awkward for you? That's okay. It'll take some practice. Any increased pain doing that?
Just in my knees.
Just in your knees? Well, we'll work on the crepidness in your knees, because I heard that as well. And a lot of times, as crazy as it sounds, weak quads can also lead to some back issues as well. I actually heard that from a chiropractor friend of mine. So that can be something we target as well in accordance with the back. So outside of that, again, we want to focus on the sitting, correct posture, make sure we're getting up, we're stretching. Some of the stuff we did at home, like the pelvic tilt, you can do at home as well. Again, 3 reps, 10 sets. So we're doing that, the pelvic tilt, make sure we're bracing those abs and just pushing our back into the floor. So we'll do that one. Other than that, any questions, comments, concerns? Pain-wise, how are we feeling after today's treatment?
About the same.
About the same?
Mm-hmm.
Okay. Other than that, I guess we'll head up front. We'll get you scheduled for your next appointment.
Thank you.
Thank you.